怎么去加的呢？我要加 Alvin。
你 start 了吗
？Alvin，
快要进来，你要按到看的人 view 的人里面，你才可以 add 到这东西。
Okay. Hello, we'll promote. Great. Hope that. Okay. Go live. I'm inviting Alvin in. Hi. Hello, 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 my friends. Hi. Now.
Hi. Can see me? Yeah.
Can everybody see Alvin now?
Yeah. Can you guys see me right today? I hope you guys can see me today.
Can anyone acknowledge whether you can hear Alvin as well? If you can, maybe write something,
All right.
Or give us a sign. Yeah, give us a sign.
Hi, Shalini.
Hi. Okay. We still have some time. I'm going to wait for someone.
People, yeah.
Cherish some.
Are you recording this one?
I'm not. Can you do it? Can you do it?
Okay. Hold on.
I'm not very good with all this. Really.
But just record with another phone.
You can record.
Right.
All right.
So yeah, we're recording now.
Okay. Hi. Thank you, my friend in India. Okay. I'm sure India have a Barral trained visceral therapist, because I know one guy from India. We met him in Singapore. I'm sure India would be a great place for visceral therapist. Yeah, it's a great technique for everyone to know, to understand, and to apply on your clients. If you are physio here, I'm sure that we have a lot of physio friends in this Instagram. Yeah, Alvin, your friend.
Yep. Of course.
And then, as usual, I'm going to talk a little bit about the anatomy and physiology of the kidney, and then you will share with our friends about the symptom, and then we will talk a little bit on the indications, and then the test. I'm in the Mandarin version. I didn't show them the kidney test, which is straight leg raise. Maybe we can do it here, or we can share a little bit about the straight leg raise. Yeah. Okay. So we will start now. Shall we?
Sure. Yeah.
Okay. So everyone, I have my puppet here. Okay. We have a left and right kidney. Okay. This is my left. Is it your right?
This is my left. Yeah. I mean.
This is my left.
If let's say, it's opposite side.
It's opposite. Anyway. Okay. I'll just talk according to my body language. All right. This is my left, and this is my right. Okay, and then the attached is the little elephant, is a bladder. All right. So in anatomy, the right kidney is a bit lower because of the liver positions, and the left kidney is a bit higher. All right, around 11 to 12 ribs. 11 to 12 ribs. Okay, floating ribs, and the right kidney is slightly lower at the 12 ribs. Okay, so and then the structure of the kidney. Kidney is the one of the we call it. Attachment is they have the weakest attachment in the abdomen, unlike all the other organs where they have the ligaments to hold that in place. Like in the liver, they have the ligaments, and then stomach, every organs they have a ligament to hold them. But for kidney, they have no physical structure, the physical ligament to hold them in place. What they rely on the few factors. Okay, the first factor will be the fat, the renal fat around the kidney, to wrap it around and keep them safely tucked under the diaphragm. Okay, we also use the negative pressure in the diaphragm to hold the liver, to hold the kidney in place under the liver. So the fascia of the kidney they are anterior and posterior. So they wrap around the kidney like this with the closure at the top. So the kidney will never glide up away from the fascia. All right. But then the bottom is open. It's open canal. So the kidney will glide down and up, glide down and up. The motility of the kidney is down, up, down, up. All right. With the mobility will be when you breathe in, go down. Breathe out, breathe out, it go up. Breathe in, down. Breathe out, we go up. So as other all the other organs, every organs have motility and mobility. They have to move. All right, every organs, they must have movement. So other than the negative pressure in the thorax and also the renal fat that hold the kidney in place, what else? Turbo effect of the other organs, like the hepatic flexures. On the right side will be the hepatic flexures. It just kindly, gently lock the kidney in place. But these structures are still weak. So if there's any changes of tone, of any muscle change, fascia, ligament flexibility changes, the kidney will still come down from the original positions. So we will talk a little bit of physiology, why kidney will become pitosis, right? Here we will target not the organic changes of the kidney, like we are not talking about the inflammation in the kidney, we are not talking about any kidney stone, but we will talk about the pitosis, which will cause a lot of musculoskeletal symptoms in our body due to the positions of the kidney, the compression of the nerve and the muscles. So where we were like, suddenly I lost track. So okay, why kidney will come down? Okay, I'll talk about the physiology, why kidney can come down. This is a lot of questions that I got from my client. They always ask me, why is my kidney coming down? I say, okay, there are many factors. Okay, first, you know that the fat around kidney is very important. So if you have a rapid weight loss in a short period of time, this fat will disappear first, right? According to PFA, this fat around the kidney will disappear first. The first to disappear is kidney, all right? So it will come slide down because there is no support from the fat anymore. Yes, okay. And then secondary, all right, chronic coughing. Chronic coughing, when you cough a lot, you know that the thoracic pressure is very high. It keep pushing down. So the kidney will also come down, plus the gravity effect, right? And the third, okay, the changes in your pleural gliding. You know, when you have pneumonia, your pleural flexibility become very hard. Okay, it change the diaphragm muscle tone. It will also affect the kidney because the kidney rely on the negative pressure, rely on the diaphragm to hold it tucked underneath the diaphragm. So if the diaphragm muscle tone is change, the kidney will also glide down. They are unable to go up against the diaphragm. So this is the pushing factor. What is the pulling factor? Pulling factor has to come down from below, right? From the colon. From the colon, from the cecum. If you have the operations from the uterus, have the operation from the cecum, there's a scar. There's a scar, they will change the cecum's, we call it flexibility or gliding. And then when this cecum flexibility has changed, you know that the fascia of the kidney attached to the fascia of Torres. The fascia of Torres wrap around the colon, all right? So, and it attached to the back. So this is the fascia of Torres. Huh? So when the problem in the cecum, okay, pulls down, the kidney will also glide out together due to the tension in the fascia of Torres. So this is the pulling factor that we say from the lower abdomen organs. Okay, so uterus, female who has IUD. Okay, so you also have the changes in the muscle tone in the pelvic floor and also the ligaments that attach to the organs. They will also pull the kidney down. Trauma, okay, when you have a trauma, you have a fall on the cord, say you have a fall on the rib cage, it will also bring the kidney down in the place. Okay, this is the physiology. This is the factors that affect the kidney. What else? Operations, yeah, chronic UTI, chronic infections, kidney stone, and other factors. Okay, yeah. So after all these factors, I will let Alvin share with us some of the symptoms that you might come across when you have a kidney problem.
Yeah, I mean, just now, so we can understand from the anatomy and the physiology. So one of the main thing that I think most of us that is how to say, like concern, you know, or think about is actually the pain. Okay, so as like what Evelyn was sharing just now, because of the sliding of the kidney, so of course there will be a compression on the nerve, you know, or maybe the vascular, you know, so you will actually have a back pain. Okay, so if let's say you guys have back pain, So most likely it's coming from the kidney because of the sliding down of the kidney. And besides that, you also have this knee pain, okay? Because if let's say you look at the anatomy of it, it's actually there are, how to say, a few nerves coming from there, okay? Like the genital femoral nerve, lateral femoral cutaneous nerve.
Yeah.
Yes. So
Iliohypogastric nerve. Yeah.
yes. So
Right.
there's so right there, and then it can actually cause like low leg numbness, like knee pain, maybe like sciatica as well. So that's one thing that we often how to say, like neglected when we talk about sciatica. We thought like, oh, it's actually coming from the leg, or it's actually just coming from the nerve. But what is actually causing the sciatica to happen? Maybe it's coming from the kidney itself because of the sliding down of the kidney. So for us as a visceral manipulations therapists, what we actually do is actually to detect what is actually the dysfunction. Is it from the kidney itself that is causing the compression? So we need to make sure that it's mobile and they have the mobility and the motility as well. Okay, and so what another thing is actually when you do exercise, okay, especially like those sit-up exercises, you actually have a low back pain. That's one thing I realized from my clients, okay, because of the sliding of the kidney, okay, so it's actually compressing on the iliopsoas, okay, or maybe some of you know it as a hip flexor, okay, because of the kidney, and then it's actually just in front of the muscles, okay, in front of the psoas muscle.
On top of that.
Yeah. So that's why, because the muscle, the nerve is actually coming out from the muscle, okay? So just imagine if let's say you're always crunching it, okay? So you're actually compressing the kidney against the nerve. Yes, so that's why you're actually irritating the nerve, where it doesn't like to be touched, but you just keep pressing on it. So that's why you have this issue, the pain,
After
the numbness.
exercise.
Yes, after exercises. So we thought like, oh, maybe we go exercise. Oh, thought like, it's gonna strengthen our back, and then but yeah, sometimes the pain is still there because you're not treating the root cause of it. You're just how to say, like causing more irritation to the structure. And like what Evelyn was saying, that kidney has the least support among all the organs, okay? So it's actually by just the pressure from the thoracic pressure, and also the abdominal pressure to keep it in place, okay? So it's quite important to know, to understand the anatomy and physiology behind. And one thing I want to talk about is also this, when you have kidney dysfunction, it's kind of similar like stomach, like what we were talking about yesterday. When you're wearing the seat belt or very tight belt, okay, you will actually feel some discomfort on it, because as you guys can see, where is your waist, that's where exactly the kidney is. So if let's say it's sliding down, yes, so we are actually causing a lot of compression. So again, it's causing another irritation, causing another pain to your body. So that's why these are some of the symptoms that you guys can notice. And there's one more case that from my patient, every night, okay, maybe it's a habit, okay, but she will actually drink a lot of water. I wouldn't say a lot of water, but just one glass of water, and then she'll go to toilet in the middle of the night, which when I see her and when I saw her that time, I say, okay, it's not normal, okay, because you're not having any diabetes, okay. Normally only diabetic will have this kind of I would say,
urinary, yeah.
So it's kind of abnormal. So I did a assessment on her, and I was like, oh, okay, I found something wrong with her kidney. I fixed her kidney, and the next day itself, she texted me, and then she said, hey, Alvin, you know what? I didn't go to the toilet yesterday night. I was like, okay, I was like surprised. Although she's still drinking the water, and but she's not going toilet anymore during the night time. Yeah, so that's one thing that I want to share with you guys. So sometimes it's it can cause this urinary problem as well, because
it's like always, yes.
Yeah, so we have left and right, and so the right side normally is actually related to the digestive system because of the liver, okay, on the right side because of the liver. And then the left, so like just now, Evelyn was sharing with us that sometimes when we have this pregnant woman, you know, or after the surgery, you know, then it may cause the kidney to pull down and then cause, because the left kidney is actually related to more what do you call this, a reproductive
urogenital. We call it urogenital.
Yes. Yeah, so actually both are still kidney, and they may have present different symptoms sometimes, you know. Yeah, and yeah, so that's one thing that we should actually keep in mind, that, you know, maybe we have associations, symptoms that caused by the kidney. Yeah,
and I also need to, I think I forgot, I need to add on a factor that causes kidney tosis. Just now I forgot, sedentary lifestyle. So if you sit too long, if you travel a long hours in the plane or in the car, I think this is what we are happening now, right? Sedentary, we are all in the lockdown, all right? So be careful of your kidney. If you sit too long, you might end up a kidney tosis. Okay, and then add to the symptom that Alvin just shared. Probably I want to elaborate a little bit on the left kidney symptoms, because left kidney tosis, left kidney is a sexual kidney, right? So why do we call it sexual kidney? Because the blood flow from the urogenital on the left side, left scrotum, left prostate, and left ovary or uterus, they all have to flow back to the left kidney via the renal vein. All right. Unlike the right side goes straight into the vena cava, inferior vena cava. So when you have a tosis in the left kidney, you have a stretch of the vascular system. All right. The vascular will be stretched as well. So when the vascular is twisted, it will cause some poor flow, right? Spasm, and then the turbulence in the flow will be bad. So you have a venous congestion in your abdomen or pelvis. So I have few clients who see me with left kidney tosis. One guy claimed that he has a deep abdominal pain. Left abdominal pain was so uncomfortable, and doctor can't find anything with him, and no one says that he has kidney tosis. But when he came to me, he has a 3rd-degree kidney tosis. All right, so the kidney was so low, it dropped near the groin, and this is causing him a lot of pain and deep groin pain. So we fixed him, and after that he asked me, does it cause the swelling in the scrotum? Yeah, I say so, of course. When the kidney drops so much, it will cause the poor blood flow. And then I didn't know that he has a swollen scrotum until he asked me about the symptom. Yeah, it will cause the venous congestion. Not only venous congestion, it will also cause varicocele. Varicocele is a symptom in the guy where they have the twisted varicose vein in the scrotum. All right, this is another symptom. So people who has the left kidney tosis, especially maybe man or female, have to be aware, because it will affect your sexual functions. Okay, yeah, especially men, right? Sexual functions. It's because of the blood flow. It's not that, it's very scientific. It's about blood flow. Yeah, and also because of the... Yes, and also Elvin, thank you, Elvin, to add on the psoas. But the psoas, I forgot to talk about psoas muscle. Yes, kidney glide on top of psoas muscle. So all this nerve on top of the psoas will be compressed. So when we talk about the kidney degree of tosis, right? We have 1st degree, 2nd degree, 3rd degree. So there are different level of tosis. The 1st level and 2nd level has show us more symptom. Right, the patients suffer more from the 1st and 2nd degree tosis. 3rd degree, because they are so low in the abdomen already, they already skip quite a few numbers of nerve, so they are not compressing directly on nerve. You might not feel so much symptom, but what you feel is a heaviness in the abdomen, discomfort in the abdomen. All right, but when you are talking about the 1st degree and 2nd degree, 1st degree they compress on the intercostal nerve at the T12. So when you have a 1st degree tosis is not like it really come down in the space, but it's more like it lost the mobility. It's not gliding anymore. So when it's not gliding anymore, it's constantly pressing on the intercostal nerve. So when you press on the intercostal nerve, you have this subcostal pain, the rib pain. It's very uncomfortable, and this pain can radiate all the way down to the umbilicals because of the nerve distributions, the route of the nerve. Okay, that's the 1st degree tosis. 2nd degree tosis, like what Elvin said, lateral femoral nerve. So you will have symptom to the lateral side of the thigh. All right, maybe slightly anterior mostly at the lateral side, you might feel numb or discomfort. Yeah, not really painful, but just discomfort. So when you have a third degree, sometimes you press on the femoral nerve. Femoral nerve, they have a saphenous nerve that goes into the medial capsule of the knee. So you may have a knee joint problem that you think that is arthritis, but ultrasound, X-ray will not see any changes in the capsule. But the capsule is really irritated from the nerve. So you can't do squatting, you can't do kneeling. And this psoas muscle spasm caused by the kidney, not only the kidney cause psoas muscle spasm, it also can cause lumborum, quadratus lumborum spasm. Yeah, because they are just besides the muscles. So psoas muscle spasm will people who has this psoas spasm, they will want to externally rotate the leg, right? And then compensate, do a lot of compensation with the ankle and foot, and especially the navicular bone, first cuneiform, and also the fifth metatarsal. These three parts will be greatly affected by the kidney. So when you have a compensation from the knee, from the feet, due to the psoas spasm, and then when the feet cannot adapt anymore, it will go up to the knee. When the knee lost the ability to adapt, it will go up to the hip. So it's a we call it ankle origin. Yes, but structurally it's ankle, but it's a visceral origin. So it's a visceral problem that causes all these joint changes, all this joint compensation. So when you treat the joint itself, it will not help. So in our visceral manipulation, we will combine the joint and also the visceral.
Yep. So I mean, it's very important to find out what is causing the pain or the dysfunction, and then we treat accordingly. Because sometimes we don't. People normally will expect us to like, oh, I come in with a let's say a shoulder pain, you just treat my shoulder. That's what happening. Okay, but for us, we study. We're trying to find out what's the root cause, what is causing you to have the pain. Okay, is it the visceral organs? Okay, or is it the joints? Okay, or maybe there's a combination, both organs and also the joint and muscle as well. So yeah, so it's very important to to do a proper assessment. So normally first time, I think it may take some time to really assess and really find out what's the problem. And in the first session, sometimes we may not, like for myself, it may take me maybe 2 to 3 times of sessions to really find out what is the cause, what is the real cause of it. Because sometimes we treat like structure A, it feels better, okay, then it came back again, okay, then we go to a structure B, oh, it feels so much better, and then we go combination A and B, and then they feel tremendously reduce the symptoms. So sometimes we have to like really find out, and it takes some time to find out what's the cause of it. Because sometimes like for visceral manipulations that we are talking about, there's an overlapping sometimes because of due to maybe previous trauma, okay, like just now Evelyn was sharing. So due to the previous trauma, it may actually covering, it just hiding, masking themselves, where you can't really feel it. And then like just now we were talking about the kidney causing the knee pain. So you thought it's a knee pain, maybe it's arthritis, but it's just a masking. It's just a first symptoms or just a sign, okay? It's just a puppet, but the mastermind behind is actually the kidney is causing the pain on your right knee, on your knee, okay? So that's one thing that we need to, want to share about, Yeah.
Yeah, it's true. I guess I think Barral, all the Barral trained therapists are being told you only feel first, think later. You do not assume. See, like for us, we have seen a lot knee pain, right? And then for us, if you start to assume that this knee pain is definitely caused by the kidney, wrong. So we cannot assume, though that there are a lot of cases, it is definitely caused by kidney. But kidney might not be the original. Okay, kidney might be affected by the liver. So when we are doing the visceral manipulations, we always are told to feel first, right? Find the restrictions. So what is the biggest restriction that we find on the day, on that time when the client see us? It might take us few sessions to unpeel, right? Layers after layers to find the original root cause of all the problem. So it's a very tricky, I think, complex technique. So
It is.
not easy to master, but it will be very rewarding for any manual therapist or any client to have the experience with the visceral manipulation. Not only visceral manipulation, it is not a single technique that can do everything. Visceral manipulation also have to be we call it complete by the vascular nerve manipulation, because a lot of times the nerve also needs help from from therapists and joint as well.
True. I mean, that's why it's just how to say, it's just another tool for us to give value, add value to our customer.
Yes.
It's not just like, visceral manipulation is the best technique. No.
Yes.
We are just using another approach to add on to our skills that we already have. Like for myself, I'm a physiotherapy trained, so I already have my background of like dry needling or some myofascial release, and of course as dry mobilizations, manipulations. So yeah, I mean, it's just another add-on for me, and for my clients as well. When we have something, the reason why I actually explore visceral manipulations, neural manipulation, is because I actually have a client that that time when I went to the course, I actually learned, okay, just listening, okay, just an assessment technique, but I can't really treat. So what happened to this patient is actually he's actually having this lower back pain for many years, and he went to see a chiropractor. Doctor asked him to stop his workout, and he's actually an Ironman. And he went to see physio, but still, still the pain is still there. And also that time also causing him what we were talking about, the lateral thigh pain. Okay, so he's actually feeling some coldness on the thigh. So that time when I was doing the assessment, I was like, okay, I just learned this technique. I just try to assess, but I can't treat yet. So I told him, I feel something is actually pulling me to the right side of the abdomen. So I was just ruling out, like, okay, maybe it's a liver, kidney, colons, etc. So these are the few structures that we were just talking about. I was just sharing to him. And then after that, he was telling me that, actually, last week I went to see a doctor for medical checkup. And he was sharing with me that something wrong with the kidney, okay? Something wrong with the filtration problem, okay? So one thing of the kidney main function is actually to filter our urine, So yeah, so if I told him, if let's say you have kidney problem, most likely it's your right side, okay? Because that's what I was feeling, and that was what I detected, okay? Although I can't tell him exactly that time that is actually coming from the kidney exactly, but I know the structure or where is the site of the problems, okay? So sometimes for us, when we do a general assessment, we are trying to find out what is the main thing first, okay? Then slowly we try to zoom in to find what is actually the main cause that is causing us to have the pain and the dysfunction. Yeah.
But like what we want to share about all this, what the purpose of our sharing with everyone about this is that to understand your body and don't keep repeating the same treatment if it's not helping you at all. So like us, if we try a few techniques and it's not working, we have to think from another point of view and then try to assess what is going wrong with the body. Because like Jean-Pierre says, after 47 years or 48 years of practicing, he's still learning. He always said that we never know enough about the body, all right? And the body is very complex. But we know that our hands can be trained, and then we can be very sensitive. We can improve on our manual technique to help our clients. So in fact, the kidney is one of my favorite, because in my clinic setting, I have seen a lot of people who have back pain, knee pain, even the urogenital problem. We solve it with kidney. Yeah, it's really amazing. Yeah. So not only not only that we can solve the musculoskeletal pain with kidney. I have a case that it's my own mom, right? She has a chronic cough for 2 months, right? Chronic cough for 2 months, and I'm so busy I didn't have time to treat her so bad, And one day she told me that she has a increase in her blood pressure. Despite the normal blood pressure medication that she's taking, her blood pressure increased so much. She's very worried. She wants to see a doctor to recheck whether they should change her medications. So I said, okay, since that you have chronic cough for 2 months, why don't I do an assessment on you? And it brings me to her bilateral kidney. It's very strange. It really goes to bilateral side of the kidney with a stronger one on the right side. So right side, when the kidney came down, it might also stretch the left kidney because of the connections through the fascia, connections through the blood vessels, the renal artery. So I fix her kidney, I bring her back, realign the mobility, and 3 days later, she told me the blood pressure become normal, become a usual blood pressure. So we are not saying that we can fix everyone with a blood pressure problem, but from this example, because the kidney lost the normal motility and mobility, it will also change the functions. Because kidney is one of the we call it circle, one of the organs that control the blood pressure. So in my advanced visceral manipulations course by Romerity, we were taught how to improve the kidney viscoelasticity, to improve the filtration functions of the kidney as well. But we are not doing any promising things for everyone. We just said through visceral manipulations, we can do so much more that we might not know. Other than addressing the musculoskeletal pain, we also can help with the functions of the organs. Overall wellness of the client will become better.
Yep. Yeah. So we are treating the mechanical issue, right? You are when there's when the pen, let's say, is not moving properly, so we can actually find out and fix it. But if, let's say, there's a pathological issue, okay, like there's a cancer or maybe a kidney stone, okay, so we are not treating that kind of problem. We can't treat that kind of problem because it's a contraindication, because we might actually cause more issue if, let's say, we were to try to treat the
kidney stone in ureter, you can.
Okay.
But not kidney stone in the kidney. So we for us, if we are not experienced enough, we do not mess with the stone in the kidney. But if the kidney stone already come out in the ureter, and we can help by gliding. But it's another story. Depends on the experience.
True. That's true.
Some visceral manipulation can be so good. Some are new learners. So we will stick to what we know best.
So you guys have any questions, you guys can just comment below, and then we can try to answer if you guys have any questions, like about your pain or dysfunction. All right.
One thing, the pain pattern of the kidney, I need to highlight. If you have pain in the morning, all right, get better 10 or 15 minutes after waking up or after you go to toilet, but the pain start again in the late afternoon. Until it gets so bad, till the night. Once go back to the bed, it become better. That is kidney. All right. Just remember this one. Kidney has a very, very clear pattern of the pain. We call it nocturnal pain in the afternoon. Very obvious. And if you have a blood pressure at home, you measure both sides. Okay, either the cuff one, you measure both sides. If the blood pressure, the systolic, we are looking at systolic. Okay. If the blood pressure on one side is lower by about 20 mmHg, that side of the kidney has problem. So the simple test that you can do at home, other than straight rays, Alvin, you want to talk about straight rays again?
Yeah, I mean the straight rays. Yeah, can you guys hear me? It's a bit lag. A bit
lag already.
Yeah. So so in what SLR is just lying down flat on your bed, okay, or on the floor, firm surface, okay, and then you just lift up your leg like what we were doing on the first day for the liver, okay, and I think we can pose it later. on the Instagram or the Facebook to show how to do the SLR. Okay, because is the image still lag? Because from my side it's still a bit lag.
Yeah, it's lag. Maybe
Yeah.
we should call it an end. Is the exercise is the test that we show during the first day with the lever. If you want, you can go back to look at the lever, but now the position of the hand will be different. You are pressing on the kidney instead of the lever. I think we would redo another short video on the celiac race later. Okay?
Yeah, sure.
Yeah.
All right.
So if you are if no one has questions, we will have we'll end the sessions here. Tomorrow we will talk about spleen and pancreas and spleen. Yes. Okay. So bye.
Right. Bye-bye.
Bye. Bye.
Bye, guys.